Hello and welcome back. My name is Becca, and today we are going to do a class on upper back pain relief. So the most common chronic condition in the United States is low back pain, but upper back still affects many people, a lot of people in the West, especially because we're slouching, driving, eating in this flexed position for most of our day. So it's very normal. Now, when we think about upper back pain, we usually think about our thoracic spine. So we have 12 vertebrae of our thoracic spine start at the bottom of our neck and end at our umbilicus, or the bottom of the rib cage. And in addition to the vertebrae, we also have cartilage in between the bones. We have muscles supporting on either side. We've got tons of nerves. So many different reasons why an upper back can hurt. And so today, how we're going to approach this class is basically bringing mobility back into the thoracic spine, moving it through all of its ranges of motions. Like I said, generally we're just doing this. And we have 6 different directions of motion that our thoracic spine can move. So let's move it in the other ways too. We're just going to need a strap today, or a belt, or something that you can pull on between your hands. And then we'll get started seated. Actually, I'll stay facing you. What we're going to start off with is, well, first, grounding. Close your eyes. And let's all take a deep breath in through the nose together, filling the lungs. And then sigh it out. And I want you to breathe into your rib cage and imagine it expanding from front to back. And now can you imagine the rib cage as you inhale expanding from side to side, left to right? Feeling the side bodies opening, spreading like wings. Now inhaling from top to bottom. Getting taller on the inhale, and exhale, contracting. Inhale, ribs lift away from one another, spreading, extending, stretching. And exhale, settling. And now 360-degree breathing through the rib cage, or 6 directions you can think of: front and back, side to side, and top to bottom. And then as you exhale, everything coming back to this central point in the center of the torso, also known as your Manipura chakra, which is the seat of your personality, your drives, your inner fire, the ego. Good. We'll take another clearing breath here, opening the mouth to let it go. And then we'll slowly blink our eyes open. Okay, so now what we were going to do is CARS. So this is essentially an exercise that brings all your different all your different joints through all of their ranges of motion. So the general principle is you should be moving all of your joints and all of their ranges of motion every day for maximum mobility and minimizing pain. But obviously, we can't always do that. So we're going to focus on our neck and our thoracic spine today. So the first one I call the Night at the Roxbury. We're going to take the right ear over to the right, and then extend the chin forward. Make a half circle in front of you so that the left ear ends up over towards the left. And then draw the chin towards your neck, making your best double chin. And then continuing this motion of making a circle, almost like if you had a marker under your chin, you're drawing big circles underneath your head. And now let's switch the direction. Left ear left, Extend the chin forward. Draw that half circle in front of you. Right ear right. And your best double chin, drawing it around. And again. And trying not to move your upper back or your shoulders here. Just trying to isolate the movement. I find it helpful to keep my hand on my chest. Good. Now we're going to bring the chin down towards the chest. So neck flexion. And then we will twist the chin over towards the right shoulder. Now laterally bend your right ear towards the right shoulder. So tilting the left ear up. And then roll the head behind you. This is neck extension. And we end up in a lateral bend over on the left. We'll twist the chin over the left shoulder and then drop the chin back down to the chest. One more time that side. Coming around, we'll find the twist first. Lateral bend. Roll the head behind you. Lateral bend left. Twist left. Chin to chest. Good. Switch sides. 2 on this side. Coming into the lateral bend before you extend the head back. And after you extend the head back, and then twisting, chin to chest. So I know we said that we'd be focusing on the thoracic spine, and this is not your thoracic spine. But your neck is intimately related to your upper back. A lot of the muscles in your neck attach to your upper back. So actually a lot of our upper back pain might be coming from the neck muscles and vice versa. Your trapezius is the biggest muscle, and its fibers actually run all the way down the thoracic spine, almost down the whole way. So that's a big culprit actually for upper back pain in people, and it starts in your neck. Okay, moving on to our thoracic spinal cars. So for this one, you can hug a block. You can also just hug your shoulders. And we're going to do a similar range of motion here. So we'll begin to flex the chest, or the upper back down, so that the chest comes down. And then we'll find the twist, so rolling the chest open towards the right, facing the right. And then lateral bend, drop your right shoulder down, lift your left shoulder up. And then roll the chest open, extending, almost like a cow pose here. And as you do this, imagine pressing the heart into the arms so that you're finding lifting and then extending rather than just dumping back. So a nice long spine, nice extended long spine. Good, coming into the lateral bend left. Twisting, and then rolling forward. And let's do that one more time, that side. Twist, lateral bend, lift the heart, extend your chest up. Coming around, lateral bend, twist, flex. Good, reverse. Twisting left, lateral bend left. Big opening. Good, lateral bend, twist, flex. And last time here. Keeping the low belly drawing in. Pelvis is supported and stable here as we isolate the thoracic spine. Good. Okay, taking the hands behind your back. Let's inhale, lift the chest, look up. And exhale, can you stay here, lifting the chin a little more, maybe dropping the head back. Pull the shoulder blades together, and then inhale, lift the head. And exhale, uncross your legs, bending the knees and taking the feet in front of you. And then grab hold of opposite elbows underneath your knees. Let your head drop down. And you can even widen your legs here so that your head has a lot of room to drop down towards the floor. Letting the head be really heavy. Letting the arms be heavy. Really staying with the sensation in the shape. So if the mind begins to wander, just coming back to the bodily experience. And we'll slowly come up, crossing at the ankles. We'll find tabletop here. From tabletop, we will do thread the needle. So this, in my opinion, is the Mac Daddy of thoracic spinal release. I love it. We're going to inhale, lift the right arm high, twisting the chest open to the right, and taking a look at that right thumb. And then exhale, crawl the right arm under. Tap the right ear down. And then inhale, open back up. And exhale, thread the needle. So if you've done a lot of yoga classes, let's do one more like this and then we'll hold. You'll notice that a lot of times, good, let's hold this one, guys. You'll notice that a lot of times we come into thread the needle like that with those alternating opening and crossing. And there's actually a reason for that. In physical therapy, it's called just the contract relax technique. And when we activate opposing muscle groups, it actually allows each one to open to a greater extent than with static stretching. We'll take one more breath. And sigh it out. Really twisting open. You can extend your left hand forward if you like. Maybe picking up the head, walking the right ear back, and then maybe stepping the left foot back. If the left foot is back, knee lifted, imagine spinning the outer left hip down. And spinning the left tricep down if it's extended forward. Good. Left knee comes down, left hand under the left shoulder. Inhale, the right arm comes all the way up. And exhale, circle the arm. Take the right hand back up, curl it around the lower back, and then just let the left ear fall towards the left shoulder. Right hand back up, right hand down. Other side, left arm lifts, inhale, look at your thumb. And exhale, thread the needle. Inhale, lift back up. Exhale, thread the needle. Last one, inhale, open, stretching from breastbone to breastbone. And then exhale, threading the needle. And then again, option to walk the right hand forward and maybe stepping the right toes back. Finding external rotation of your upper arm bone. And release. Right knee down, right hand under the right shoulder. Inhale, lift the left arm up. And then exhale, circle the arm. Switch directions. And then we'll lift the left arm, tuck it behind the back, reaching for the right inner thigh, inner hip point. And then drop the right ear towards the right shoulder. And release. Left arm reaches up, left hand down. I'm going to do some scapular push-ups now. So what we're doing here is isolating the motion of our scapula. So the arms are straight during this exercise. Knees are underneath the hips, belly hugging in. And it's a very small movement. First thing we're going to do is draw the shoulder blades together on the back, letting the chest fall towards the floor. Good. So this is retraction of the shoulder blades. And then we'll press into the floor so that the shoulder blades separate and the front of your chest hollows out. This is protraction. Retract, protract. Good, let's do a few more like that. And this is really targeting rhomboids. Also your scapular stabilizers. Rhomboids are the muscles between your shoulder blades. And for a lot of us, they're weak. And so if there's any kind of twisting in the thoracic spine, the muscles can't stabilize that. And so they're working too hard, but they're not strong enough, and they end up getting sore. Good. Okay. So now we're going to come into protraction. So feeling shoulder blades separate. I don't know about you, but the space between my shoulder blades is burning, which is good. And now in protracted shoulders, we're going to tuck the chin, coming more into a cat pose. And then keep the protraction on the shoulder blades. We'll tap the hips back towards the heels. You don't have to go all the way. Keeping the chin tucked, coming forward, shoulder blades separating, hollowing out the belly. Good. And now let's retract. Shoulder blades draw together. We'll lift the head and coming into a cow pose. Can you draw your shoulder blades towards your hips more? Feeling them squeeze together and draw down. Good. Now let's tuck the toes. We'll walk the knees back slightly and then come forward into something like an up dog or high cobra. Good. And then coming back into cow and then high cobra. Good. Cow. We'll hug the belly in a lot. Let your neck relax. Come into a neutral table. And then with the belly contracted, we'll tuck the toes, lift the knees, finding downward facing dog. Press the floor away from you as you send the chest back. And if you are feeling particularly tight in the backs of the legs, bend the knees. So we're isolating the upper back, or we're working the upper back in this class. So if your hamstrings are getting in the way of your upper back mobility, just bend the knees and take the hamstrings out of the equation. In down dog, I want you to feel for hugging the upper arm bones in and then spinning the triceps down. And then can you do the same with your lower arm bones and spinning the pinky side edge of your forearms down. Good. Now step the feet together. Knees can stay bent. We'll lift the right leg high, three-legged dog. Inhale. Exhale, stack your hips, bend the right knee. Let the right toes reach for your left butt cheek. And then look under your right armpit. Feel the sides of your neck lengthening down towards the floor. Three-legged dog on your inhale. Square your hips, squeeze your glutes, and exhale, charge your right knee in towards your chest. So we're protracting shoulder blades here. Inhale, send the knee back, three-legged dog. And exhale, down dog. Other side, left leg lifts, inhale. And then exhale, stack your hips. Relax the right heel down. Bend the left knee and reach left toes for the right butt cheek. Looking under the left armpit. Let the sides of the neck relax. Inhale back to center. Hugging the outer hips. And then exhale, charging the left knee forward. Pressing the shoulder blades apart. Inhale, three-legged dog. Exhale, down dog. Look towards your hands. Come onto your tiptoes and bend the knees. Inhale. Exhale, step forward. Inhale, halfway lift. Peel your heart forward, lifting the back of the head up. And then exhale, fold. Bend the knees a lot. Relax your head. Inhale, peel the heart forward, lift the tailbone back. And exhale, fold. Last one, inhale. Drawing forward, sides of the waist lengthen. Inner thigh spin back. Exhale, fold. Bend the knees. And you can ragdoll the arms or grab opposite hands underneath the legs. Shake the head no. Nod yes. Bend the knees. Release your hands and we'll roll to stand. Let your head be the last thing to stack. Really soaking up that neck stretch at the end. And then roll the shoulders back a few times. All right, we'll inhale the arms up. And exhale, side bend. So the right hand will draw down the right hip. Actually, let's take the right hand to the right hip point. We'll step the left foot behind the right, coming on the ball of the left foot, and then reach the left arm up and over. This right hand is pulling the right hip point back so that the hips stay square. Back to center, inhale. Exhale, other side, left hand, left hip point, right foot steps behind the left leg. Right arm up and over and pulling left hip point back. Back to center. We'll inhale, arms up. And exhale, fold. Circling the arms down. Step your left foot back, drop the left knee. Press down into both of your legs, feeling the glutes turn on, and then inhale, lift the arms. Belly point drawing in and up. We'll get tall, inhale, and then exhale, goal post your arms, pull the elbows down. Press the backs of your hands back. For this one, let's make our best double chin, drawing the chin back. And then reach the arms up, inhale, and exhale, circle the arms. And then reverse the circles. Pressing down into the feet. And then let's sweep the arms forward, folding over the front leg. Tuck your back toes, lift your back knee. Thunderbolt pose. Good. Sweep the arms back behind you. Lift your pinkies, feel the triceps turn on. Spin your right or your left inner thigh up. Good. Arms go back forward. Inhale, rise up, crescent lunge. And then exhale, thunderbolt. Arms reach forward. This time we'll come into a twist. Left arm outside the right knee. You can make a fist. You can make prayer hands. Squeeze your glutes. Hug your outer hips. Draw the belly in and up. And reach forward through the crown of your head. Look down. Inhale, rise, crescent. And then exhale, hands down. Step the left foot forward, fold. Inhale, halfway lift. And exhale, fold, step the right foot back, drop the right knee. Inhale, crescent lunge, Anjaneyasana. And exhale, find your back bend, driving the elbows down. Think about scooping the back of the heart up. Inhale, arms reach up. Exhale, circle the arms. Feeling the traction of your back shin and your front foot on the ground. Switch directions of your arm circles. Arms reach up, tuck the back toe. Inhale, lift the back knee. Exhale, thunderbolt. Reach your arms forward. Biceps hug the ears. Sweep the arms back, lift your pinkies. Triceps turn on, spine is long. Back to thunderbolt and rising up crescent lunge. Inhale, exhale, twist. Look down, hands to the top of the mat, step your right foot forward, halfway lift. Exhale, fold. Inhale, sweep the arms up. And exhale, sweep the arms down. Inhale, halfway lift. Exhale, let's step the left foot back. And this time we'll ground the back foot down at 45 degrees, hugging the back thigh muscle towards the back thigh bone. And then drawing the right hip point back, left hip point forward, and driving the right knee forward. As you do all that, belly button draws in, rib cage draws down. Good. Let's inhale, arms reach up. And then sweep the arms behind you. Inhale, press the knuckles down, lift your heart. And exhale, humble warrior. Right shoulder is inside the thigh if you can keep your hips square. If you cannot, we'll just hover the chest over the right thigh. Fist comes overhead. Full expression, we'll take the fist all the way overhead to the floor. Keep drawing the right hip back, left hip forward. Draw the belly in, tuck your chin, inhale, rise all the way up. Exhale, release. We'll come into a goddess pose, release your fist. Facing the side of your mat, heels in, toes out. Grab hold of your strap. So remember how I talked about those fibers of your trap, and they reach down really low. And for a lot of us, they're weak. They're very small and they're hard to target. So we're going to try to work those today. Let's come into our goddess squat. So knees roughly over the ankles. And take the strap in your hands. Take your forearms forward. And then pull the wrists so that they're over your elbows. Drop your hips down, belly in, rib cage down. Now, we're going to try to pull the strap apart. So obviously we're holding tension and we're not actually pulling it apart. We're going to imagine that we can tear the strap apart, keeping the forearms parallel. Let's slowly draw the strap up towards the sky. Really hug your core in here. And then exhale, draw the elbows down. Oh, this is hard for me. Good. Again, inhale. Stable through your pelvis, stable through your ribs. Exhale. Strong legs. Last time. Inhale. Exhale, and as you exhale, drop your hips down lower. Inhale, draw the strap back up, straighten your legs. Exhale, drop the strap, side angle, back of the mat. Left leg is forward. So the left forearm comes to the left thigh. We'll sweep the right arm up and overhead. And then roll the top shoulder behind you. Exalted warrior, right arm reaches up and then slides down the back leg, left arm up and over your head. Good. Take the hands down to frame the front foot. Step your right foot up to meet the left, halfway lift, look forward, and then exhale, fold. Right foot steps back. Warrior one leg's here, so if you need to split the legs apart more to keep your hips square, go and do that. Roll the back edge of your right foot down, feeling the back arch lifting, and then hugging the back thigh muscle to the thigh bone, bending into the front knee, hip square. Navel draws in, Mula Bandha in, and rib cage down. Arms reach up, inhale, warrior one. Exhale, circle the hands behind your back. Interlace the fingers. Inhale, press the chest up as you reach the knuckles down. Exhale, belly in, warrior, or humble warrior. This goes up and overhead. Left shoulder is either inside the left leg or the torso hovers. You can look at your belly button. You can look at the floor right below you. Breathe. Fist to the low back, tuck your chin, inhale, rise up. Exhale, release. We'll find goddess legs again. Heels in, toes out. This time we're going to take the forearms together, so this is a little bit weird. Take the forearms together, palms touching, and then roll the backs of the hands together. And then as you have that, then we'll pull the hands apart. Okay, find your goddess legs. Mula Bandha in, and then we'll take this whole system of the arms and just lift it up towards the sky. Hug your belly, and exhale, draw it down. Belly in, inhale. You can do this. Just one more round. Stay calm and breathe. And that's it. Side angle to the top of the mat. Right forearm to the right thigh, left arm reaches up and over. Squeeze your back glute a lot. Imagine rolling your torso to the ceiling. And reverse your warrior. Keep the bend in the front leg. Arc your right arm up and over. And then windmill the hands towards the front of the mat. Frame your front foot and step the right foot back to meet the left. Down dog. And if you want to add a vinyasa in there, be my guest. Good. So we're going to walk the feet back, so we're in a very long dog. Very long dog. And drop the forearms down. And then press the chest back towards your thighs. So this is in an effort to be friendly on the upper back. We want to release it and not strain it. But if you feel like taking a full dolphin today, you can walk the toes towards your elbows. And that's going to intensify the extension in your thoracic spine by a lot. think about spinning the outer arm bones away from you. And what I basically mean by saying that is the upper arm bones are externally rotating, creating more space between your shoulders. Good. Drop the knees, and then we'll come forward, slither forward, if you will, into Sphinx pose. Elbows underneath the shoulders, or if that's too intense, you can walk the elbows forward. Forearms parallel. And then you have the option to drop your head in between your shoulders here if you prefer. And when you're ready, we'll come down onto the belly, prone. I know I said thread the needle's the Mac Daddy. This is also a baby Mac of thoracic spinal opening. So this is an inner arm opener that I love dearly. You will take your left hand under your left shoulder and the right arm out to the right. So you have the option of taking a 90-degree bend, and this is going to be the most intense. You can open it up to 180 degrees, which will be the friendliest, or you can do somewhere in between. If the elbow is bent, we're going to get a lot into these big tendons in our elbow, which is great, but if they're already irritated, it could be a bit much. So just listen to your body. So with this left hand, we'll begin to apply pressure, rolling onto the right inner arm. And you can even tuck your knees underneath you here if you like. On your next exhale, can you relax 10% more? And then we'll release this. Reversing the steps, we'll extend the legs coming back onto the belly, onto the chest, and then take the right arm down by your side. Just rest for a moment. And then we'll take the right hand under the right shoulder, left arm out to the left in any position. Pick up your chest, roll onto the left inner shoulder, and then maybe roll onto your left hip, perhaps bending the knees. Exhaling the tension away. And we'll reverse that. Unbending the knees, coming back onto the belly. And rebending the left hand, or the left arm. Press back into Balasana, child's pose. Take the knees underneath you together for this version and sweep the arms back. Slowly walk the hands forward, rising up onto the knees, and then taking the legs out in front of you. So we'll do just one more exercise and then Shavasana. So we'll come onto our sides, pick a side. And you're going to extend your bottom arm in front of you and then take your top arm on top, palms touching. And then we'll take the right thumb or the top hand thumb down and make a big rainbow overhead. And as the hand comes overhead, starting to roll the face, the chest open, following the arm, and then opening the top arm all the way out to the opposite side. Pause, and then come back. And again. You don't have to worry too much about keeping the knees together if there's tension in the back anywhere. Just let the knees open. Good. One more round. Okay, we'll come back. We'll come onto our backs to get the other side. I'll go this way. Palms start off touching. And take the top hand thumb down, pinky side up, and then we'll arc the arm overhead. Opening into our supine twist, and then coming back around. So the gaze, the head is following the arm. And what we're doing here is gently mobilizing our thoracic spine. To round off our upper back practice. Last round like this. This time, once you're in your twist, we'll just roll all the way open onto our backs. And then extending the legs long. Shavasana. Dear friends, please take as long as you need in your Shavasana. I hope this class served you today. If it did, leave me a comment. I'd love to know what worked for you. And I will look forward to seeing you again right here on your mat next time.